Good morning and welcome to the University of Scranton. My name is Michelle Maldonado, Provost and Senior Vice President for Academic Affairs here at the university. And I want to thank you for joining us this morning for an important announcement for the university, our friends at Geisinger Commonwealth School of Medicine, and for the greater Scranton community. As you probably know, in 2008, the University of Scranton opened and ran the Edward R. Leahy Jr. Clinic for the uninsured for free non-emergency health care to uninsured Lackawanna County residents. With the 2020 pandemic, the clinic, like the campus, was closed. Since that time, we have been able to reopen through the Leahy Clinic a counseling clinic, physical therapy clinic, and low vision clinic. We have graduate programs in all of these areas. We were not, however, able to reopen the medical clinic. It is around this time that we began conversations with our friends and colleagues at the Geisinger Commonwealth School of Medicine. This pause has given us time together to reimagine what a medical clinic could be and the educational opportunities it can provide, as well as how the clinic may be able to operate in a sustainable fashion. And we think we came up with a solution. I'm pausing for dramatic suspense here. To tell you about that, it is my pleasure to introduce William Jeffries, PhD, Provost for Geisinger College of Health Sciences and Vice Dean for Education of Geisinger Commonwealth School of Medicine, and Victoria Castellanos, PhD, Dean of the Panuska College of Professional Studies at the University of Scranton.
Hi, in case you're having trouble differentiating, I'm Bill Jeffries. But it really gives me great pleasure today to announce that thanks to an agreement between Geisinger Commonwealth School of Medicine and the University of Scranton, the Leahy Clinic for the uninsured will return in January to serve the neediest patients in Lackawanna County. I'm especially excited by this venture as I have a leadership role at Geisinger, but I'm also an alumnus of the University of Scranton, so it's a great thing to see these two institutions get together. The Leahy Clinic will offer care to the uninsured in a manner that aligns two fundamental driving forces of these two organizations. For Geisinger and its College of Health Sciences, it is the quality of care and outcomes with great attention to the social determinants of health. For the University of Scranton, the Jesuit ideal of cura personalis, or care for the whole person, drives this mission. Both organizations focus on teaching the value of service and the importance of giving back to the community. The new Leahy Clinic will be different from the one the pandemic closed. First, it will offer longitudinal care as opposed to just acute care. At Geisinger, our focus is on wellness and prevention, which can only be accomplished when patients develop long-term, trusting relationships with their providers. It will also offer a rich clinical experience to a variety of learners, from nursing and medical students to physical therapy and occupational therapy students. So this is a win for all learners. They will act as members of a healthcare team and will learn to thrive in interprofessional settings. The clinic will provide the perfect system to hone their teamwork skills. It will also be a win for our patients, who will have access to quality care and through lasting relationships with providers and students. Another thing I'm particularly excited about is that in this system is that so much of the health and wellness depends upon successful system navigation. And this will be an entree for all of our students to participate in the management of a clinic. At Geisinger, our education is steeped in system science. We want our learners to understand how the system works so that they can make it work for their patients. For that reason, I'm very proud of the fact that this clinic will be student-run. In this clinic, learners won't just show up and be told what to do. Here they will manage, decide, and lead. What an incredible opportunity it is for them. Of course, the clinic will have properly licensed physicians in the oversight of care, but University of Scranton and Geisinger students will make important contributions in operational and clinical decisions. The Leahy Clinic is a win for our underserved population. It's a win for our university students. It's a win for Geisinger learners, including the resident physicians who will rotate through the clinic. It's a win for our entire community to have such fruitful partnerships that benefit everyone who lives and works here. There are so many people who came together to make this free clinic happen, and I'm apologizing in the very beginning of this because I don't have everyone's name. I'm definitely going to leave someone out, so please forgive me. But I do wish to acknowledge with great gratitude Jerry Zaboski and John Grabowski for their leadership, along with Father Jim Duffy, Dr. Jerry Maloney, Dr. Michelle Maldonado, Dr. Susan Russell, who will be our director, Dr. Mary Jane DiMatteo, Ron Beer, Dr. Amanda Caleb, Dr. Vicky Castellanos, Ed Steinmetz, along with many, many students, including Madison Gladfelter, who you'll hear from later, Seth Ellison, and Olivia Zale. So with that, I will conclude my remarks and turn it over to Vicky.
Thank you, Dr. Jeffries. The clinic is located in the lower level of McGurrin Hall, which is just out the back door here, and has a separate entrance from Kressler Court. The facility provides space for patient examination, treatment, and consultation with various healthcare providers, as well as reception and waiting area for patients. It includes additional spaces for the education of both patients and students. Drawings of the floor plan of the clinic can be seen to the side of the room for your reference. This partnership allows a broad scope of care to be provided through the medical clinic and allows the university and Geisinger Commonwealth School of Medicine to offer our students an interprofessional experience closer to what they will experience in their professional careers. The medical clinic will provide a place where interprofessional teams of students in nursing, health administration, occupational therapy, physical therapy, health promotion, and counseling and human services, along with pre-med and medical students, they can work together, learn together, and serve together. The much valued service and learning opportunities the medical clinic will offer extends beyond the programs offered here in the Panuska College Professional Studies to students throughout campus who are interested in pursuing careers in medical and human service fields. Service in the clinic in past years has included students from numerous degree programs throughout campus, through community-based learning projects, as well as through volunteer service opportunities. For instance, students from World Languages and Cultures have helped translate health guidelines and procedures, have served as patient translators, and students from many majors have trained as medical scribes and have served as part of a student leadership team that raised money for the clinic. Cooperating with Geisinger's medical students makes this experience even more valuable. We are grateful for the partnership, which starts today, and for the rich learning experience it will offer for medical and university students. I want to especially thank Mary Jane K. DiMatteo, PhD, RN, a valued faculty member in our nursing department, as well as a physical therapy faculty who supervise the student-run pro bono PT clinic, for their assistance in greatly fine-tuning the plan for this clinic. I greatly appreciate their dedication and expertise. This is another great example of an interprofessional team working together to achieve positive outcomes for the uninsured patients that will be served by the clinic. We plan to open the clinic beginning in January 2024. Thank you.
Thank you, Dr. Jeffries and Dean Castellanos. As you just heard, medical and university students have been actively involved throughout the planning of the clinic and will continue to be involved through the student-run model for the clinic's operation. It is now my pleasure to introduce a medical student who is part of the planning process for this initiative. Madison Gladfelter graduated from Westchester University and is now a third-year medical student at Geisinger Commonwealth School of Medicine. Madison?
Thank you, Dr. Maldonado. When we first started discussing the idea of a student-run free clinic, I didn't know if it would come to fruition during my time at Geisinger Commonwealth School of Medicine. It has been an honor to see the idea of the student-run free clinic come to life. As future physicians, we all want to have an impact on our community, and for us, that is helping to ensure that everyone has access to health care. When the pandemic caused the Leahy Clinic to close its doors, part of the community lost their access to health care. With this partnership, this community will now have access to longitudinal health care starting in January of 2024. A student-run free clinic will allow the community to shape us into the physicians of tomorrow. Our first and second year of medical school is dominated by book learning. We spend most of our time trying to understand the different disease pathologies and their treatments. However, behind every disease, there is a patient that has the condition. Most of our clinical experiences up until the beginning of our third year consist of practicing on standardized patients, a cast of actors that allows us to practice our certain physical exam skills, and for many of the future medical student volunteers, the clinic may mark the first time they conduct a physical exam on a real patient. This can serve as a reminder to medical students that you are not treating the disease, but you are treating the patient. A student-run clinic is also a place of mentorship and interprofessional teamwork. The clinic will be composed of interprofessional team of students such as nurses, medical, pre-medical, physical, and occupational therapy students who will have to work, learn, and serve together. And together we'll serve our community, ensuring that every person has access to health care. Thank you.
Thank you, Madison. Now I would like to introduce Julie Byerly, MD and MPH, President of Geisinger College of Health Sciences, Dean of the Geisinger Commonwealth School of Medicine, and Executive Vice President and Chief Academic Officer for Geisinger. Dr. Byerly.
Thank you so much. What a joyous celebration. This is so fitting for what we're trying to do at Geisinger and at Geisinger Commonwealth. At Geisinger, of course, our mission is to make better health easy. And there's a lot to unpack from that simple statement, but for today's purpose, I want to think about what it means to our community. We're an integrated health system committed to community, and Geisinger Commonwealth School of Medicine is a school founded by and for the community. Geisinger Health System, the investment of Geisinger, the continual investment of Geisinger into our medical school and the academic components of what we do through the system is an investment into community health and well-being. We're a system that educates people to make better health easier using their skills in science and service. And when you think of the people in our community who most need attention with compassionate skills and service, it's the people in Scranton that this clinic will work to serve. It's the people who come to the Leahy Clinic that come to mind, who will benefit from our learners and our teachers investing their knowledge and skills in science into direct and hands-on clinical compassionate service. So I'm delighted today that we have announced this partnership that will care for our most vulnerable here in Scranton and make better health easier by providing a place where people can come for care, not just acute care, but longitudinal care. That's really special. And that's care that will hopefully keep people well, active, and out of the hospital. The clinic, of course, will also advance our educational goals, and we're also thrilled that the clinic will advance our goals of building a pathway into the health professions. One of our desires at Geisinger Commonwealth is to influence the region and inspire young people into careers in the health professions and inspire them to want to come connect in our community, get to know the people of our community, grow roots in our community, and stay long-term. And this really advances that cause. There's so many reasons to be proud and grateful today. Better health, better education, science and service opportunities, and building relationships in our community. So I'm very grateful to all the leadership of the University of Scranton that is helping to make this happen, and all the many volunteers who have already participated and I know will continue to participate in ensuring this is a reality. Especially I want to thank Father Marina, of course, and for your leadership and support of this joint effort, and know that we appreciate the partnership. Thank you.
Thank you, Dr. Byerly. Now I would like to introduce Reverend Joseph G. Marina of the Society of Jesus, President of the University of Scranton. Father Marina.
Good morning, everyone. All of those remarks were so beautifully presented and so comprehensive. I feel like saying, I just agree with all of that and then go and sit down. Of course, I won't do that, but I feel like it. Thank you, Dr. Maldonado. Thank you, Madison. Thank you, Dr. Byerly, of course, Dr. Jeffries, Dean Castellanos, and to all of you who have played such an important part and who have labored for more than a year now to bring this wonderful idea to reality. Also, a very special thank you to the students from the medical school and the university who have been so instrumental in leading this program forward. We deliberately and often at Scranton say that a Jesuit education is transformational. And part of what that means is not only that we want our students to be well prepared in whatever discipline they happen to choose, but we want them to be leaders as well. Leaders who are genuinely committed to serving others, to promoting human dignity, especially in the poor and the marginalized. We want them to be a fire that kindles other fires, as we also say around here these days. To light a spark that will inspire future physicians, nurses, other healthcare providers, students from all disciplines for generations to come. By caring for the health needs of the most vulnerable members of our community, our students are doing exactly that. And how wonderful it is to see the missions of both Geisinger and Scranton align so beautifully in that regard. Our students are accompanying people on their journey. They're attending to them, they're building them up, all while tapping the God-given gifts and talents that they possess. I can't tell you how rewarding it is when I see the fruition of our aspirations come to life in the actions of our students. I never get tired of seeing that, and I am awestruck each and every time. That's what happens at Geisinger, that's what happens at Scranton. Lots of thank yous went around today. They were all well-deserved. I'll just embellish on one, and that is to acknowledge a brother Jesuit, Father Jim Duffy, who, like a good Catholic, is sitting in the last row. Father Duffy is the religious superior of the Scranton Jesuit community. As many of you know, he's also a medical doctor with extensive experience working in clinics like ours and clinics for the poor. He's been an invaluable resource throughout the planning process. Jim, thank you so much for all you've done. And now, I know we're all eager to get this agreement signed, so I'm not going to take up any more time here other than to say thank you once again for all that you have done and continue to do for the university, for Geisinger, for our community, and for the most vulnerable. May God continue to bless this partnership and bless all of you gathered here today. Go Royals and go all future doctors and healthcare givers. Thanks for listening.
Thank you, Father Marina. Now, for the signing of the Master Affiliation Agreement, I call Dr. Byerly and Father Marina to the table for the signing. And I would also like to invite Dr. Jeffries, Dean Castellanos, and Olivia to join me in witnessing the signatures.
Is it? Yeah. Oh, good. Thanks.
This concludes the program for this morning. I wish to thank you again for joining us for this important announcement for the students of Scranton and at GCSOM and the greater Scranton community.